Throughout life, the human body changes on many levels, and these changes also affect our sexual health. While many people believe that sexuality is only an issue for young people, it is important to understand that sexual health also plays an important role in old age. Loss of interest in sexuality or difficulty finding satisfaction are not insurmountable problems, but natural reactions to physical and hormonal changes. The importance of sexual health in old age lies not only in the functionality of the body, but also in the perception of intimacy and closeness. Sexuality is an important part of human well-being and a source of emotional connection, even in old age. Studies have shown that sexual activity in old age contributes to an improvement in quality of life, increases general well-being, and can even prolong life. People who accept their sexuality and understand that it can also be healthy in old age experience a deeper satisfaction with life. It is important that older people do not allow themselves to be influenced by social norms or myths that portray sexuality as something for younger people. Instead, they should learn to accept themselves, recognize their needs, and develop healthy practices that promote their sexual health. This includes a balanced diet, regular exercise, adequate sleep, and psychological exploration of one's own sexuality. Those who understand that age does not mean the end of sexuality have the opportunity to lead a fulfilling, self-determined life. This also applies in this regard. With increasing age, the physical conditions for a functioning sexuality change. These changes are completely normal and affect both men and women. A common problem is the decline in the production of sex hormones, especially testosterone in men and estrogen in women. These hormonal changes often lead to a decrease in sexual desire, sensitivity, and sexual response. For men, weaker erections, reduced libido, or a longer recovery time after orgasm can be signs of age-related changes. In women, estrogen production decreases, which can lead to vaginal dryness and possibly painful intercourse. Such changes can lead to frustration and dissatisfaction, but they are not a cause for concern. There are numerous methods to counteract these problems. The good news is that there are solutions to improve and maintain sexual health in old age. Regular blood circulation through physical activity and a healthy diet can help promote sexual health and performance. Strengthening the pelvic floor muscles is another important method for improving both erectile dysfunction and sexual response. For many men, taking medications such as Viagra or alternative remedies can provide significant support. For women, vaginal moisturizers or hormone therapies can help make sexuality pain-free and fulfilling again. The most important insight here is that changes in sexuality with age are not insurmountable obstacles, but rather a signal that new, adapted solutions can be found. By addressing the physiological aspects, you can understand how the body works and develop solutions that enrich your sex life even in old age. Sexuality in old age is not only influenced by physical factors, but also by psychological and emotional elements. Access to sexuality changes as people age, and this can lead to insecurities and fears. Some people feel less attractive, feel that their bodies are no longer capable of performing sexually as they used to, or experience feelings of shame about the changes they are going through. The psychological component is often just as important as the physical one. Many older people are afraid of intimacy or shy away from sharing their sexual needs with a partner. Feelings of shame or fear of no longer being good enough can lead to sexuality disappearing from life altogether or to an inner conflict building up. It is crucial to maintain an open dialogue, both with yourself and with your partner. A healthy sexuality in old age also means accepting yourself and understanding your own needs. This can be achieved with a positive attitude towards self-care and sexuality. It is important that older people learn to see themselves as desirable and capable, and that they are able to enjoy intimate moments without fear of judgment or rejection. Psychology plays a key role in overcoming sexual problems in old age and maintaining a fulfilling sex life. Counseling or therapy can also help break down psychological barriers. For many older people who have difficulty understanding or accepting their sexuality, seeing a therapist or sex counselor can be the first step toward positive change. Psychological support enables people to overcome the shame and fears associated with sexual development in old age and helps them rediscover the joy of sexuality. With increasing age, not only does the body change in terms of hormone production and sexual appetite, but also in its ability to process and utilize nutrients efficiently. A balanced diet is therefore crucial for promoting sexual health and general well-being in old age. The right diet can compensate for many of the physiological changes that come with aging and help maintain both physical vitality and sexual function. Those who want to maintain their sexuality in old age should not rely solely on external factors, but also understand the importance of a nutrient-rich diet. Vitamins and minerals for sexual health. Important micronutrients such as vitamin D, zinc, magnesium and B vitamins play an essential role in regulating sex hormones and overall sexual health. Vitamin D, for example, is crucial for hormone production and maintenance. It affects libido by influencing testosterone production in men and estrogen levels in women. It is recommended to consume vitamin D-rich foods such as fish, eggs, and mushrooms, and to spend time in the sun regularly to promote the production of this important vitamin. Zinc is another important mineral that not only strengthens the immune system but is also directly related to sexual performance. In men, zinc is essential for testosterone production and maintaining sperm quality. Zinc-rich foods such as oysters, beef, pumpkin seeds, and cashews should be included in the diet on a regular basis. Magnesium supports blood circulation and helps relax the muscles, which has a positive effect on sexual health. It also promotes general well-being by calming the nervous system and helping to manage stress, which in turn can lead to better sexual performance. Vitamins, especially B6 and B12, are necessary for regulating hormones that influence sexual desire. These vitamins are found in whole grains, green leafy vegetables, eggs, and dairy products, and contribute to balanced hormone production. 2. Antioxidants and blood circulation. With age, blood circulation tends to slow down, which can particularly affect sexual function. Poor blood circulation is often associated with erectile dysfunction in men and sexual dysfunction in women. Antioxidants, such as vitamin C and E, found in a variety of fruits and vegetables, play a key role in promoting healthy blood circulation. These nutrients support the walls of blood vessels and prevent them from being damaged by free radicals. Berries, such as strawberries, blueberries, and raspberries, are excellent sources of antioxidants and help improve blood circulation, leading to better sexual response. Green leafy vegetables, such as spinach and kale, as well as nuts and seeds, are also rich in antioxidants and should be consumed regularly to support sexual health. Fats and their importance for hormone production. Healthy fats are also an important part of a balanced diet for good sexual health. Fats, especially omega-3 fatty acids, found in fatty fish such as salmon, mackerel, and herring, have a positive effect on blood circulation and hormonal balance. These healthy fats also help reduce inflammation in the body, which can promote sexual appetite and performance. Trans fats and saturated fats, which are often found in highly processed foods and fast food, should be avoided as they impair blood circulation and can lead to hormonal atony and deterioration of sexual function. Another important aspect of nutrition in old age is adequate fluid intake. Dehydration can lead to a variety of health problems, including reduced sexual performance. Adequate hydration not only supports physical vitality, but also helps to keep the mucous membranes well supplied with blood, which is important for sexual enjoyment. In women in particular, adequate fluid intake can help prevent vaginal dryness, which can lead to pain during sexual intercourse. Drinking water, green teas, and natural juices helps to hydrate the body while providing nutrients that support hormone balance. Plant-based foods are not only nutritious, but also rich in fiber, which aids digestion and has a positive effect on hormone balance. Many plant-based foods such as pumpkin seeds, avocados, nuts, and olive oil are rich in healthy fats and nutrients that contribute to sexual health. Plant compounds, such as flavonoids, found in citrus fruits and berries, have anti-inflammatory properties and can help regulate blood pressure and improve circulation. Including plant-based foods in your diet promotes balanced hormone production and can therefore support sexual health in a natural way. Erectile dysfunction, ED, is a common problem in older men and can have a negative impact on self-confidence and quality of life. However, erectile dysfunction is by no means an inevitable consequence of aging. There are many solutions that can help improve sexual health and maintain a fulfilling sex life in older age. The causes of ED are varied and can include both physical and psychological factors. The first step in dealing with erectile dysfunction is to identify the cause and take appropriate measures. Physical causes of erectile dysfunction. Erectile dysfunction can be caused by various physical problems. One of the most common causes is poor blood circulation. With age, blood vessels can become narrowed or blocked, which reduces blood flow to the penis and thus impairs the ability to achieve an erection. Conditions such as diabetes, high blood pressure, and high cholesterol also contribute to poor blood circulation and can cause erectile dysfunction. It is important to consult a doctor if you experience erectile dysfunction in order to rule out or treat any physical causes. There are treatments that can help improve blood circulation and support erections. These medications dilate the blood vessels and allow better blood flow to the penis. 2. Psychological causes of erectile dysfunction. In addition to physical causes, psychological factors play an equally important role in the development of erectile dysfunction. Anxiety, stress, depression, and a negative attitude towards sexuality can lead to reduced sexual performance, especially in older age. Insecurities about one's own attractiveness or performance in bed can affect sexual self-confidence. To overcome psychological stress, it is important to talk openly about your fears and concerns. Good communication with your partner and a willingness to seek professional help from a therapist or sex counselor can help overcome psychological barriers. Simply talking to someone can be enough to restore trust and intimacy, which has a positive effect on erections. Lifestyle changes.
Lifestyle has a significant impact on sexual health in old age. Regular physical activity, a balanced diet, adequate sleep, and stress reduction are crucial for improving sexual function. Exercise, especially activities that promote blood circulation, such as walking, swimming, or cycling, can help improve erectile function. A healthy lifestyle not only helps improve sexual function, but also supports overall well-being. Maintaining a healthy weight, avoiding excessive alcohol consumption, and not smoking are key factors that promote sexual performance and reduce the risk of erectile dysfunction. 4. Alternative remedies and natural supplements. Many men also look for natural ways to treat erectile dysfunction. There are various herbs and dietary supplements that are considered to increase potency and support sexual performance in old age. Among the best-known natural remedies are ginseng, maca, elodinine, and yohimbe. These are herbal remedies